Okay, so who is Tanisha?
We're live. Stand by and cue.
Okay. Hapaday. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Thursday, March 11, 2021. The time is 2:46 p.m. I apologize for the delay of today's hearing. It was supposed to begin at 2 p.m. Public notice for this confirmation hearing were disseminated via email to all senators and all main media broadcasting outlets, and also published in the Guam Daily Post on Thursday, March 4th, and again on Tuesday, March 9th, 2021. For those who are going to testify, when you are recognized by the chair, please state your name for the record. Thank you. So the two agenda items we have are, one is the reappointment of Therese Nicolas to serve as a member, the Nutritionist-Clinical Dietitian representative of the Guam Board of Allied Health Examiners for a term length of 3 years from February 19, 2021 to February 18, 2024. The second appointment on today's agenda is the reappointment of Ray C. Terlaje to serve as a member, the Physician Assistant Representative of the Guam Board of Allied Health Examiners for a term length of 3 years from April 27, 2020 to April 26, 2023. I'd like to acknowledge the presence of my colleagues here, beginning with my Vice Chair on Health, the Senator Sabina Perez, Senator Frank Blas Jr., Senator Joanne Brown, Senator Terlaje, Senator Tony Ada, Senator Chris Duenas. Some of these senators have been on Zoom with me all day for several hearings back to back, and I very much appreciate their presence and participation. Okay, so first we will begin with the reappointment of Therese Nicolas to serve as a member of the Guam Board of Allied Health Examiners. She is a Nutritionist-Clinical Dietitian representative to the Guam Allied Health Board of Allied Health. All right, I'm just going to point out some of the duties for both of these confirmations. Some of the duties of the Guam Board of Allied Health is to, of course, promulgate rules and regs, develop and adopt a budget, evaluate the education and training of applicants, select and administer licensing exams, evaluate previous professional performance of the applicants, issue or deny licenses, approve or deny licenses for renewal, review investigative reports and complaints received from law enforcement agencies, healthcare organizations, governmental agencies, insurers, and other entities that have pertinent information regarding the professional performance of licensees. Discipline licensees, and there are others, but pretty much that's the core, and that's, I think, the very, very important duties of this board, and all the other powers they have are related to these duties. The two of the nominees today are both the reappointments, so we will begin with, like I said, Therese Nicolas. We have, for the record, received written testimony from Jessica Alingog, who is the clinical dietitian at GRMC in support of the nominee, from Rose Calvo, RDN, LD, Supermarket Dietitian, Payless Markets, Inc., from Maria Gersaniba, RDN, LDN, Registered Dietitian, Fresenius Kidney Care, from Melissa Ortiz, RD, LD, Registered Dietitian, Fresenius Kidney Care. All of these testimonies were in support of the nominee. All right, so I'm going to, Mr. Nicolas, thank you again for your continued willingness to serve on this board, and we will accept any testimony that you would like to provide at this time.
Good afternoon.
Dispense up, Mr. Nicolas, dispense up. I'm going to let the nominee go after there's others who are here to testify on your behalf. I forgot. And so if I could start with Dr. Tanisha, there you are. Dr. Afflequi, Dr. Tanisha Afflequi, you may begin.
Buenas, just want to see Madam Speaker Terlaje for the opportunity to speak today, and to the rest of our legislature present. It's my honor and privilege to speak on behalf of Catherine Nicolas and her reappointment to the Board of Allied Health Examiners. To start, I'd like to point out that Kathy's license number is 001, which is a significant marking of her first life, she being the first licensed dietitian to practice in Guam. Moreover, that 001 also represents the path she's trailblazed to more women in dietetics like myself. I was blessed to have met Kathy in a professional capacity early in my career, right out of undergraduate school, and at the Guam Memorial Hospital Authority, where she was director of the dietary department. At this point in my career, I was preparing for a dietetic internship and was seeking on-the-job experience. While working under her supervision as special diet assistant and later dietetic intern, I witnessed her undeniable work ethic ensuring quality assurance for the entire department. Throughout my dietetic internship, she always made time for me to address my questions or walk me through the nutrition care process or healthcare procedures. For as long as I've known her, going on 17 years now, Kathy was always supportive of aspiring dietitians like myself and other students. More recently, she has been a guest speaker for several nutrition classes at the University of Guam, where she carries the same level of energy and enthusiasm for the field of nutrition as she did when we first met. I observed her taking time after presentations to connect with students to address questions or extend career guidance. During her term on the Guam Board of Allied Health and Examiners, Kathy established and maintained regular communication to the Guam Dietitian Network on any and all updates related to licensure, local procedures, or nutrition guidance, even through the pandemic. For these reasons, I'm providing my unequivocal support to her reappointment and find it to be most fitting during the week that International Women's Day started, National Nutrition Month, and Mess Tomorrow. Kathy has not only paved the way for tomorrow women dietitians, she has fostered new and supported all dietitians that practice throughout Guam. So for these reasons, that concludes my testimony, and I apologize. I failed to follow your instructions of introducing myself. So my name is Tanisha Aflui, and I'm an associate professor of nutrition at the University of Guam and a licensed dietitian.
Dr. Aflui, thank you for your testimony. That comes, that's a very high recommendation right there. Thank you so much for your service as well and all your contributions to our community. Dr. Catherine, we will hear from you now.
Good afternoon, Honorable Speaker Therese Terlaje, and the members of the Committee on Health, Land, Justice, and Culture. Senador Sabina Perez Hafaday, Senador Terlaje, Senador Joanne Brown, Senador Christopher Duenas, Senador Frank Blas, and who else is there? I think that's it. Sidus Maase, thank you for giving me this opportunity to speak on my reappointment confirmation hearing for the clinical dietitian nutritionist seat of the Guam Board of Allied Health Examiners. I am known as Kathy, so please address me as so. And the Guam Board of Allied Health Examiners covers 14 allied health professions, from acupuncture to veterinary medicine. That's our A to V, with 13 active board members. Much guidance and support are afforded to our board through our legal counsel, our Assistant Attorney General, Robert Weinberg, and the staff and management of the Health Professional Licensing Office. In the past 3 years of serving in the board, not only have I been absorbing and learning the mechanics of the board, but also I have participated in the work group's grueling task of reviewing and updating the administrative rules and regulations, and have supported the adoption of the codes of professional conduct and ethics that was introduced, by the way, by Speaker Terlaje in July of 2019. Last year, I was elected the board treasurer by my fellow board members, giving me the responsibility for the oversight of the board's finances and regularly submitting the financial reports at board meetings. Each new calendar year, the board elects its officers, and again, I was reelected board treasurer for this year. In my capacity as a clinical dietitian nutritionist board member, I have reviewed and recommended the approval of up to 10 new clinical dietitian and nutritionist license applications and the renewals of 24 dietitian nutritionist licensees this year, for a total of 27 licensed clinical dietitians and nutritionists in Guam. In comparison, the last renewal period, that was in December of 2018, there were only 23 licensed clinical dietitian nutritionists in Guam. From my board experience, I have gained an unprecedented admiration and respect for those who have and are serving active in boards in concurrence with their professional careers, as I have witnessed a whole new level of the dedication and commitment to maintain the integrity and professionalism that board members are expected to uphold. And to this day, I am still absorbing and learning. Some history information about me: I have been a registered dietitian since 1987. My dietetics career launched after graduating from the University of Hawaii at Manoa with a Bachelor of Science degree in Food Science and Human Nutrition, and attaining my Master's in Public Health Nutrition from the School of Public Health at the University of Hawaii at Manoa as well. I returned to Guam to immediately start work at the Department of Public Health and Social Services as a nutritionist for the Guam WIC program. In fulfillment of my WHO, the World Health Organization fellowship requirements, I transferred to the Guam Memorial Hospital Authority in 1991 at the asking and convincing of Dr. Olivia Cruz, who was the medical director at that time. She basically threw the guilt trip on me, explaining that it was essential for GMH to staff a registered dietitian to meet Joint Commission standard for a qualified dietitian for the hospital's dietary department. Be mindful that I was one of 3 RDs in Guam at that time. She was right. However, the licensure of dietitians and nutritionists had not been established. But during my clinical work at the hospital, I had helped the late Senator Dr. Eduardo Cruz and his office with reviewing the first drafts of the bill to license the profession of dietitian and nutritionist. So Article 21 was added in Public Law 24-329 on August 4th, 1998, and the rest is history. Fast forward 16 years, I had retired from GMH in 2014 and was immediately asked by Global Food Services, a local business contracted to provide patient food services at the newly built private hospital, the Guam Regional Medical City, to help create and build the dietary and food services operations. That experience took me further to assist the dietary operations at the Naval Hospital. And a couple of years later, I was asked to join the GRMC partners and help manage the Clinical Dietary Services Department at the hospital. There, I currently hold the Nutrition and Food Services Manager position. Throughout my dietitian years, I have also worked as a nutrition instructor for the University of Guam College of Agriculture and Life Sciences, a dietitian consultant for Catholic Social Services, a preceptor for students on Guam attending the Penn State University Dietetic Technician Long Distance Program, a volunteer and mentor for the Certified Dietary Manager responsible for reviewing and approving the menus for the Elderly Nutrition Meals Program. And I also served on the National Diabetes Education Program as Guam's representative of this joint partnership program between the National Institutes of Health and the Centers for Disease Control and Prevention, CDC. It was in September of 2017 that UG Nutrition Professor Dr. Tanisha Franquist Affligui, whom at one time had been under my mentorship in her pursuit to be a dietitian, asked me to consider serving on the board of Allied Health Examiners. That was the impetus to my first appointment, and I remain committed to serving, Divine Mercy Prayer. So I remain committed to serving on the board so long as I am needed. As the first dietitian nutritionist to be licensed on Guam, I do have license number 1. I am very familiar with the process of attaining and maintaining the clinical dietitian nutritionist licensure on Guam, and I can relate to our licensees. At my first appointment, I told myself that I would want to help our medical and healthcare clinics, centers, and hospitals bring legitimate professionals in the clinical dietetics and nutrition field in a timely manner as I understood then that this was an issue. The timely nature of recruiting healthcare professionals from off-island and the fear of losing potential prospects due to lengthy license application processes. But I believe my occupancy in this seat has helped the review and approval process move smoothly. But I learned quickly that we cannot control the mail system, or as we have recently experienced, the delays caused by the pandemic. Nonetheless, we continue to work with the support and assistance of the Health Professional Licensing Office to ensure complete and thorough reviews of license applications. The board remains a strong governing body that must ensure the validity and the authenticity of the credentials of allied health professionals to be given the license to practice in their respective scope of discipline in Guam. This is a huge responsibility, which I take seriously. I have the general understanding of what the allied health professionals, most notably the dietitian and nutritionist profession, they must meet in maintaining their professional credentials, and I would like to continue my service in having the board meet its mission. Incidentally, I grew to have a deep appreciation for the work the board members put in, both in their respective discipline and collectively within our work group. And I remain ready to work alongside my fellow board members to continue to serve. Sidzus Masi.
Sidzus Masi, Kathy, and again, thank you for your service and continued interest in serving on this board and for the efficiencies that you've brought to it. It's very important that we have, an efficient licensing process so that we do not turn away anyone who we could recruit to our island to help us. All right, I'm going to begin with questions for our nominee. As soon as our second nominee is able to log back on, we will hear his testimony as well. But we'll begin now with any questions or comment from Senator Therese, Vice Chair.
Thank you, Madam Speaker. And Hafaday, Kathy, I'm so proud to hear your testimony. You did pioneer this, dietitian for career path for Guam. And I'm just really very glad and supportive of all the work that you've done after your retirement. So you continue to give back to the community to help stand up this industry and this profession. And I'm really proud to hear the professionalism that you bring to this board. And I do look forward to your continued service and to our community. So thank you so much. Thank you, Sidzus Masi. Thank you, Madam Speaker.
Thank you, Senator Therese. Senator Taisku, you're recognized.
Don't worry, Kathy, I'm not going to go after you. I just love this woman. I've known her for many years, and I've seen her interact with many people, people she don't know, people she does, many people. And especially when it comes to your class reunions, even though you're 79er, I'm a 78. I used to crash your reunion parties, and I would always meet up with you, Kathy. I think you're just a wealth of knowledge in the first place, because I would be eating like crazy at the table and feeling guilty every time you would walk by, knowing I'm probably eating the wrong thing. but like a good person you are, you let me do my own thing. And I just really am happy that you're deciding to stay on this. I mean, I know you put in a lot of time and effort in what you're doing, and most of us going into retirement soon. So I ask you, please don't even think about going into retirement, because we need people like you to continue to serve. Especially you're doing this on your own time. And I can't thank you enough for doing it. And that's why it's important that I'm here today to give you my full support and to ask my colleagues to please do the same, because this woman is an amazing woman. You can read it for yourself, but most importantly, she's a GW grad. So that alone should work. Girl, I'm surrounded by Academy girls. So believe me, I'm so happy to see you, Kathy. GW. But take care. God bless you and your family. And then please be safe, Kathy. And thank you so much for stepping up to the table again. Okay.
Yes. Speaking of retirement, I think I heard her say that she retired a long time ago, and all of these other are additional careers that she has pursued and additional service. It's really amazing. Senator Dueñas, you are recognized.
Si Diyos masi, Madam Speaker, dan undang ko nun na si Diyos masi para hago, Kathy. I listening to your testimony, there's no question that you are an institution, and it was just so refreshing to hear your reflection and what you are doing now for the community. So you most definitely have my full support, and I'm actually glad that the divine mercy went off, because this legislature could use some divine mercy. So don't even think that that's a welcome and refreshing item for us to have during testimony to add our good prayers to our efforts. But you certainly have my support, and thank you for all you do for the people of Guam. Si Diyos masi, Madam Speaker.
Just Masi. Senator Brown, you are recognized.
Thank you very much, Madam Speaker. I certainly have to say that I don't know Kathy personally, but she sounds very enthusiastic considering what an extensive career she's had. I mean, I didn't go to graduate from GW, but I see she just graduated a few years ahead of me from the University of Hawaii. So she has a very certainly impressive credentials. And I just want to say I appreciate your interest in continuing to serve your community on the Allied Health Examiners Board. I think now we're getting a greater awareness, all of us, and certainly as we get older, the importance of nutrition in terms of what we eat and what will keep us healthy and what will keep us from being sick in this community. So I certainly will support your nomination and vote on the floor. And thank you again for your continued public service. Thank you, Madam Speaker.
Thank you, Senator Brown. Senator Blasio, you're recognized.
Thank you, Madam Speaker, and to the nominee, Kathy. I think amongst everybody here, I think I know you the longest, huh? Right? Yeah, I thought so. Kathy and I actually went to elementary school and junior high school together. Okay, so, but Kathy, it's enlightening. And I'm sorry, I just need to ask one question. It's a very rare occasion that we have individuals who want to go back to a commission or to a board that they've been previously appointed to. And here's one where I guess you want to continue to serve. Most people want to run away from boards. You continue to serve there. And well, maybe it's not so much to ask you a question, but to say thank you. Thank you. It shows not just your commitment to your profession, but to the island. And I've known you for such a long time that is Kathy. That's the Kathy I know. Okay, and that's the Kathy that many people know and many people trust. Earlier you had the testimony from Dr. Aflui, and that's the Kathy that I think everybody who has come to you, who has in one way or another had an association with you, has spent time with you, knows as you. And that's what's needed in the board. Several years ago when I was the chairman of health, as the speaker as now, and having to deal with that Board of Allied Health, I think amongst the three of us, we know those little secrets about the Board of Allied Health and how long and far it has gotten to. And I think that part of that is because you're there. And I want to thank you. And because you're there and we want to continue to keep you there, you got my vote. Okay? You got my vote. So thank you, Madam Speaker. Okay, thank you very much.
Thank you, Senator Blas. Senator Ada, you're recognized.
Thank you, Madam Speaker, and to the nominee, thank you for accepting the governor's call to serve on the board again, be reappointed. I look forward to voting on your nomination, and I ask that, Madam Speaker, you please move the nomination forward so that it'll be able to make this session as it comes up. And I hope that all of our colleagues will support these that are coming through the boards for confirmation through this body. Thank you, Madam Speaker.
Thank you, Senator Ada. Kathy, can I just ask you one question too? And if it's just, so in the news lately, of course, we're talking about boards, the licensing boards, and then complaints against some of the licensees, and then the boards not always addressing these in a very timely manner or satisfactory to those who are complaining. And I guess I would just like you to talk a little bit about your experience in that regard and what you see going forward, how it's going to be better.
At our board meetings, we have addressed several of the complaints against licensees, and board members are assigned these cases to do interviews and investigate. And of course, with the assistance of our legal counsel. And if it has been, and we realize there are challenges to how Guam is so small and that everybody knows each other, and that in certain disciplines, it's very difficult to be able to do investigations because you're working with the colleague who is the individual that the complaint is against. So we have looked into getting a third party or someone else who from off island to be the investigator, primary investigator instead. That is something that, of course, with the procurement and with having to attain that type of service, it will take some time. But I believe that because there is recently a rearrangement or reorganization of the health licensing office, that we are back on track and to be able to address all previous complaints. And we're looking at having a way in which these complaints are addressed in a timely manner. None of the complaints were in my area, but I do know that in other disciplines, that was the challenge, is that the board member is also a colleague of the individual that the complaint is against. So having to find someone from off island in the same discipline was what we had to resort to.
Thank you very much. I appreciate that. I know it is, it's been a tough job lately, and resources are necessary to get those other parties who can help the boards in these types of investigations or analysis. Okay, well, that concludes our hearing for the confirmation of Catherine St. Nicolas to Guam Board of Allied Health Examiners. And I want to thank you again, Kathy. Take care. All right, so colleagues, it's 3:14 p.m. We lost contact with the other nominee who was on earlier, and so we might have to continue this. But I think I'm going to just make an announcement here to continue this hearing until 8 a.m. tomorrow, and try to get his confirmation done as soon as we can. We'll try to set him up here. We need to, just to make sure we have connectability. All right, so I'm going to continue this hearing. I'm not going to adjourn it. It will be continued until 8 a.m. tomorrow morning, which will be March 12th, 8 a.m. For the confirmation, that would be for the confirmation of Mr. Ray C. Terlaje to serve as a member, the physician assistant representative of the Guam Board of Allied Health Examiners. Okay, and then thank you again, colleagues. We'll be recessed until tomorrow at 8 a.m. Mr. Adios.